back to Live Well with Dr. Mel. I'm Dr. Mel, licensed physical therapist and holistic health coach. If you haven't yet subscribed to my channel, go ahead and click that subscribe button. You'll get access to all my free physical therapy tips and tricks. In this video, we're going to go through cervical facet syndrome. This question was actually brought to me by Donna at 217066. Thank you so much for your question, Donna. If you're suffering from facet syndrome, I'm going to go through 3 of my favorite exercises to correct this. So if you're ready, let's get started. So first, I want to go through what is facet joint syndrome. If you check out this image, each vertebrae connects, and along each vertebrae, there's little bony prominences called spinous processes. In between your spinous processes and the vertebrae are your facet joints. So you can either be caused by trauma or just degenerative over time due to poor posture. The vertebrae can begin to collapse. The spinous processes can fall closer to each other, causing irritation at the facet joints. So our goal is to gain space between the vertebrae, increase space at the facet joints so they're not rubbing and causing irritation and inflammation. So here it is, 3 of my favorite exercises for facet joint syndrome. The first 2 exercises are to correct your posture, because if your head is forward and your rounded shoulders are forward, then you're going to have more compression at the facet joint. So we want to get your neck into proper alignment over your shoulders. So the first exercise is chin tucks. Perform this multiple times a day. The more you do it, the better, because your posture is everything. So in order to do chin tucks, you're going to place 2 fingers at the front of your chin. Squeeze the front of your neck muscles to give yourself a double chin, aligning your neck directly over your shoulders. You're going to see a little gap between your fingers and your chin now because you're bringing your neck over your shoulders, putting it into proper alignment. Hold that for 3 to 5 seconds, relax, and repeat. And you can repeat this 10 to 15 times. Like I said, I would do it multiple times a day. The next exercise is scap squeezes. So you also want to make sure your shoulders are in proper alignment. They're not rounded forward, because if they begin to round forward, your neck will follow. So the way you do scap squeezes, you just squeeze your shoulder blades back, sticking your chest out. Hold for 3 to 5 seconds and relax. And repeat 10 to 15 times. Like I said, the more you do this, the better. I do it sitting in the car, driving. Anytime I find myself falling into improper posture, you want to correct this to make sure you're not in that rounded posture so you don't irritate the joints. Last and most importantly, working on your neck rotation. So a lot of times when people have facet syndrome, they have difficulty rotating their neck left and right. This is something we do daily and constantly. So we want to improve our neck range of motion, but we can't do this without getting into the proper posture first. So first, do that scap squeeze, do that chin tuck, get into proper alignment, then turn and look over your right shoulder as far as you can, or left shoulder. I went left and said right. Hold at your end range for 3 to 5 seconds and come back to neutral. This may be very difficult for you, and you may not get full range if you're really stiff. So a way you can assist it, turn as far as you possibly can, and then use your hand to bring it the rest of the way, applying a little overpressure. When working with the neck, you never want sharp, intense pain. You want to get to the point where you feel the stretch and hold it there. Never really jerk or push through pain. Just meet the resistance and hold it. And make sure you do both sides. You may find that one side is easier to turn to than the other, so you want to try to make yourself as balanced as possible too. So I would work on the side that has least range of motion more often. So remember, it's important to do these multiple times a day. It's not gonna correct itself if you just do it once. The more you do it, the better you'll feel. If you have any questions or comments, don't hesitate to reach out. I happily respond to all questions and comments. Stay healthy and well. See you next time.